Orthopedics, the femur. The femur is surrounded by muscle, good blood supply, responds well to internal fixation, best of ORI if those fractures. Bent AL nail in the femur. Traction, all form treatment requires nail internal fixation. Stress fracture of the femur, 70-year-old. Broken AO nail, need to replace it. Broken lower pin. Calcification in the femoral vessels. Cherry picker from which a 41-year-old male failed to break his femur at great height. Supercondylar fracture of the femur, child, non-operative treatment. Traction fractured femur, Dolmo splint. Subtrochanteric fracture of femur, area of high stress needs internal fixation. There's a failure fixation. Lower femur. Here's a fracture around a hip replacement, been internally fixed several times, still failing. Bone becomes osteopenic, won't hold the pins and plates. Fracture of the upper femur, and upper tibia, same child. A 20-year-old. Splint. Fracture of the femur, 2-year-old. L retraction. You have to have a little bit of overriding as they get overgrowth. Fracture femoral shaft, 48-year-old. Held with a plate. Usually a nail is better. I am nailing at 6 months, going on to union. Comminuted fracture held with a nail, 35-year-old. Again, here's a 16-year-old at 2 months. Slow healing. Internal fixation, fracture femur, patient's doing really well. There's a nailing. Fracture of a splint, 20-year-old, splint before nailed. Internal fixation, fracture lower femur. Following motor vehicle accident. Oblique comminuted fracture lower femur, internally fixed. It's going down into the knee joint. Fracture mid-shaft femur, treated in traction, 4-year-old. They'll do well in children. Often don't require surgery, or seldom require surgery in children. But in an adult, you should put a nail in it. See, overlapping, needing a nail. Lower femur. Fixation lower femur and the patella in the same patient. Nailing the femur. It's a Huckstep nail for difficult fractures. Here's a revision nailing of the lower femur. Have to put cerclage wires. Here's a failed subtrochanteric fracture of the femur. Here's growth arrest lower femur. You see this commonly in children. High velocity injury. Growth plate closed the lower femur can cause short lived. It's a real problem, difficult to treat. Huckstep nail. Nailing the femur. Patient being set up for nailing the femur. He's got traction. We're going to use this approach. Infection around a GK nail, hot bone scan. Infection around the nail, have to remove it, debride it. Large swelling posterior thighs, liposarcoma in a 30-year-old male. Here it is again, excised en masse. MRI showing an adductor tear. MRI showing contusion of the quadriceps. May be difficult to differentiate from tuber mass. May need to do a biopsy, hard to interpret it. Contusion of the quadriceps, multiple myeloma, 38-year-old internal fixation. There's a lesion there, one down here. Prophylactic pinning, and again up the upper femur, lower femur. Motor vehicle accident, nearly killed, survived. Myositis of cervicans, quadriceps. Hard to differentiate from tumour, but this is a harmless condition, as you know. Neurofibromatosis, numerous bony lesions, multiple joint lesions, dislocated here, previous hip replacement, dislocated, distorted pelvis anatomy. Neurofibromatosis, complicated MRSA, large distorted limb. Here's a non-union upper femur in Paget's. It's very common to get non-union in Paget's. Fracture of the femur, box splint from the slopes, ski slopes, comminuted subtrochanteric fracture, 21-year-old. There's a ORIF after failed fixation, 60-year-old. ORIF fracture of the mid-femur, 3 weeks in a 10-year-old. Multiple attempts of fixation and fracture in an elderly patient. Supracondylar fracture treated with a blade plate. A supracondylar fracture in the child treated with traction and minimal fixation. Subtrochanteric fracture, Paget's bone, dense bone, high incidence of non-union. Osteomyelitis around the femur, around the K nail. A dense lesion here, osteoid, osteoma, bony lesion, benign, but causes intense pain. Osteomyelitis around the canal shown on the bone scan. Distorted bone, deformed bone from Paget's, typical feature, pathological fracture with infection. Pathological fracture with infection. Post-IM now fracture, 22-year-old, doing well. Post-op after multiple trauma, pelvic fracture, femur upper mobilized with early fixation. Pathological fracture in femur from infection. Transverse fracture, typical for pathological quadriceps contusion. Recon nail, type of nail, upper femur. Rectus femoris rupture, hard to diagnose, maybe MRI, can't break the quadriceps normally, but you can break it when there's a rupture there. Supracondylar fracture, 8-year-old. Supracondylar fracture, 24-year-old, and it was quite internal fixation. Stress fracture, hot on the bone scan, stress fracture again, x-rays. Subtrochanteric fracture, 35-year-old, with quite internal fixation in this manner. Subtotal fracture and osteopetrosis, increased bone density, high incidence of non-union. A difficult supracondylar fracture of the femur, need internal fixation and traction prior to surgery. It's a rupture, traumatic rupture of the quadriceps tendon above the knee, needs internal fixation. Means internal repair. Foreign bodies, wood in the thigh, these are big problems. Fragments left behind, have to be very careful, go back multiple times to remove all the particles. Thank you for your interest.